Occupational therapists on early psychosis teams play multiple roles. The primary role is really that of the occupational therapist and looking at the different environments that the person engages in, looking at the different family relationships, all the different things that the person does to occupy their time. In addition to occupational therapy specific kinds of things, the occupational therapist plays a strong role in vocational and educational goals. As experts on the environment and how the environment interacts with people and the different things that they do, occupational therapists can come in and we can look at the different demands of the occupation, of the different activities, so such as the activity of being a student. An occupational therapist will look at what are the different demands on the individual of being a student. What is the environment, the school environment? So what's the lighting like? How far away from the board is the person sitting? What kinds of different sensory things are happening in that room that are going to affect the individual as they try to be successful as a student? And so the occupational therapist will look at the skills and abilities that the client has, and they'll look at the environments and then try and match those up. We also look at things like studying and how do students organize their time. How do they organize their materials? How do they process what's happening in the classroom? And we'll try to match up as best we can the needs of the individual with the different environmental demands and the different demands of the occupation. Saying somebody's a student sounds like a simple thing, but being a student is actually very complex. If you look in a classroom, you'll see people doing all kinds of different things to try and compensate for that environment. And that's normal. But folks in EASA oftentimes have trouble adjusting to those environments. And so as occupational therapists, we can go into those environments, we can help them better understand what's working, what's not working, make oftentimes some very simple modifications so that they can be successful in that environment. So occupational therapists working on the EASA team will oftentimes work with the educational specialist, the vocational specialist, the case managers, and we'll take the different information we have about that we learn about the clients, about their environments, about their particular needs. So what's their cognition? How do they organize their thoughts? How do they take in different information from the environment? How do they react to their environments? So do they like bright lights? Do they like dark rooms? Do they seek out a lot of noise in their environments, or do they need quiet? And what we do as occupational therapists is we gather all that information about the specific needs of the folks that we're serving, and then we can help to educate the families and the other folks that are supporting the client in order to help them be most successful in those environments.